coronavirus entered our lives about 4 years ago in 2019. Many of us know very well how much the world changed after coronavirus, because when the effects of this virus outbreak became global, we were all trapped at home. For this reason, it was characterized by many large swings, whether in the area of work, living standards, new rules, new shots, and much more. However, is the influence of coronavirus still similar? Is it still reaching? Or has what coronavirus has left behind turned everything we knew on its head? In short, a topic like this raises a lot of questions. The purpose of this video will be to address the current situation of the coronavirus. Of course, everyone knows that such a pandemic that scorched the world will not have zero impact on our current time. Nevertheless, we all need to see it up close. First, we need to briefly review the current situation of the coronavirus. The novel COVID-19 virus emerged in December 2019 in Wuhan province, China, where it originated in animals and quickly spread around the world. This was after the World Health Organization categorized COVID-19 as a public health emergency of international concern in the month of January 2020. In March 2020, it announced the corona pandemic, which has affected every sphere of life. Coronavirus is a family of viruses and comprises of different kinds of strains. Most of them are identified to reside in animals. SARS-CoV-2 is the type of coronavirus that is transferred from bats to humans and poses a danger to the health of people all over the globe. SARS-CoV-2 can remain viable on various surfaces for several hours to several days. Clinical studies show that the incubation period of this virus is 1 to 14 days. Recently, a new strain of coronavirus called Delta, with a shorter incubation period, has infected many people and has more dangerous complications. Several methods have been proposed for rapid diagnosis of coronavirus. The World Health Organization has established real-time reverse transcription polymerase chain reaction as the gold standard for early diagnosis of COVID-19. Imaging modalities such as X-ray, computed tomography, and ultrasound are also important in the diagnosis of COVID-19. While RT-PCR is necessary to confirm the diagnosis of COVID-19, it is time-consuming and carries risks for infected individuals. Therefore, initial detection is usually done by medical imaging, followed by RT-PCR for definitive diagnosis. Commonly used imaging techniques include X-ray, computed tomography scan, and ultrasound. X-ray is the first choice because of its low cost and minimal radiation risk. However, COVID-19 detection on X-ray is complex and error-prone, with a high likelihood of misdiagnosis. Computed tomography scans offer higher contrast and accurately show lung damage caused by the virus. But the process is challenging because many slices need to be analyzed. Non-ionizing radiation ultrasound is useful in diagnosing and evaluating the extent of organ injury in COVID-19 patients. In the recent past, AI in medicine has enhanced the diagnosis of diseases such as COVID-19 through DL models. These models have changed the standard of the field by reaching the accuracy of human identification of medical images. Contrary to the situation that unfolded before February 24, 2022, for more than 2 years, COVID-19 pandemic dominated almost all the global concerns. The consequences of the outbreak, which have become evident in now or shortly, have affected mobility, cross-border operations and purchases, and people's ways of living. Of course, such effects have also impacted the quality of life to a greater extent, since people are aware of them. The COVID-19 pandemic across the world has negatively affected most areas of children and adolescents' lives, with negative consequences on multiple aspects of their mental health during this unprecedented time. Specifically, the COVID-19 situation has worsened the situation of children, adolescents, and families with eating disorders and the emergence of new cases, and the severity of this disease compared to previous years has increased. Due to this crisis, the percentage of patients admitted to hospitals and those presenting at emergency centers has risen. More so, the young people defined in treatment agreed that they had more thoughts and eating disorder behaviors and less motivation to recover. New cases were reported to have tripled, although the referrals for treatment were also noted to have doubled as compared to previous years. This, coupled with high caseloads, service disruptions, among other factors, have therefore led to longer waiting lists. Factors such as school and recreational closures, isolation from peers, and increased use of social media have contributed to these increases, creating a global public health crisis in eating disorders that affects young people, families, and health professionals. The reduced risk of COVID-19 has led to deep social isolation and loneliness, evidenced by increased anxiety, depression, substance abuse, and suicidal thoughts. People longed for simple pleasures such as hugging family members or friends, eating out, or seeing a smile that was not hidden behind a protective mask. Humans are social creatures by nature. Shortly after the 1918 pandemic, when the U.S. resumed intense socialization, the Roaring Twenties brought people together in crowded dance halls, movie palaces, and drinking establishments. Some pandemic behaviors would benefit greatly from at least partial continuation if there were a social benefit. Hybrid work has survived the pandemic and even continues to evolve, giving many workers a better work-life balance and more choice about where to live. Air travel has also recovered from the pandemic. As of December 2021, international travel was 72% below 2019 levels and is now almost back to where it was. The effects of the pandemic on work and life have been far-reaching. In terms of work, the most significant change has been job loss. The number of unemployed people has risen to unprecedented levels, and this has brought economic concerns to the surface. For workers, remote working has become the norm, and given the current situation, perhaps this will be the new working style. Who knows? This proliferation of remote working has brought and continues to bring with it major changes to the nature of work, such as job demands and control. The pandemic has also led to major changes in people's lives. Issues such as changes in home life, increased time spent at home, and pressure on family relationships have come to the fore. Changes in the educational and social lives of children have raised important questions about how to support them. In short, the pandemic has had a significant impact on life outcomes such as stress, happiness, life satisfaction, anxiety, depression, and relationship satisfaction. Some studies have shown that the pandemic has exacerbated existing problems of social disconnection and loneliness among the older population, and factors such as gender, socioeconomic status, and living arrangements have been found to play a role. Research during the pandemic has focused on understanding multidimensional aspects related to social connectedness and loneliness among older adults. Research has identified structural, functional, and quality components of social relationships and examined how changes in these elements due to the pandemic have affected feelings of loneliness. Hypotheses about the impact of social connectedness on loneliness have been guided by theoretical frameworks such as social psychological loneliness theory and the resource perspective. Using nationally representative survey data from older Americans, researchers examined the association between various aspects of social connectedness, for example, limited face-to-face contact, changes in support, deteriorating relationship quality, and increased loneliness during the COVID-19 pandemic. Factors such as insufficient face-to-face contact with strangers at home, reduced emotional support, and deterioration in family and friend relationships were associated with high levels of loneliness. In addition, socio-demographic factors such as age, gender, race, ethnicity, and education level were found to influence the impact of social connectedness on loneliness. Studies show that the social and economic situation of humans has changed significantly after COVID-19. But what happened to the world economy? Let's look. The COVID-19 outbreak has entailed various effects on the globe relating to its financial structure. Among them, there has been a significant rise in unemployment being a global issue and affecting a vast number of people. In one of the large economies, such as the US, about 26 million people have been sacked within the last 5 weeks, and unemployment was pushed up to 4.4% in March levels that are the highest since August 2017. Apart from the US and UK, other developed countries like Australia and South Korea have similarly seen a rise in unemployment, and some of the economists have predicted the increase in unemployment in future. However, due to the emergence of the economic recession, the services sector also inflicted its consequences, such as the decline in the sales of retail merchandise and increased difficulties for the businesses to survive. It also impacted on the production line as the manufacturing companies could not perform to the optimum level. The mini-trade war between the leading economies like the US and China have affected manufacturing industries and supply chain. Some factories in China were still shut down for a rather long time than people anticipated and affected manufacturing firms globally. As more countries implemented crucial measures, numerous manufacturing industries were either partially shut down or the firm's access to intermediate inputs or materials was limited. In addition, due to the slow sales of the commodities, manufacturing can be terrible as compared to before. These economic adversities and volatile nature affected the world trade and manufacturing, thus resulting to slow growth and a world recession. If we look at the pandemic in 2024, new methods are being tried and new studies are being done on the coronavirus with the digital age. And although it has dealt a blow to human life, the effects of this blow will remain permanent. But remember that without these blows, human beings could not develop. The simple reason for the emergence of new methods and new approaches is actually because of these blows. Whether it is economic or social life, the impact of the pandemic is enormous. Thank you for watching the video. Till the next time.